First of all, we have to understand why we do errors. Just because the brain is not a perfect machine. It's a very, very complex machine. But some factors, as the stress, the fatigue, the temporal pressure, or in another hand, the routine, lack of vigilance, all these factors can interfere in the decision-making process. It is why, even if we are very concentrated, sometimes we are going to do errors. Fortunately, most of our errors don't lead to complications. And this figure explains very simply why the same errors sometimes can have absolutely no effect, and the same errors in another context can have a dramatic consequence. It's the same in our practice. Imagine that you have to place 1 or 2 implants in the posterior mandible. The bone is very dense. The crest is thin. We do know now, because of literature, that we can place narrow implant. I start to place my implant, and during its insertion, the implant jams. I did an error. My bone preparation was not large enough according to the bone density and the implant diameter. But now I have 2 manners to react. The first, I apply the protocol. I remove the implant, I use a wider drill or a tap, and I replace my implant. The second manner to react, I'm very irritated. The patient was late, he didn't apologize, and now my waiting room is full of patients. The morning I had a problem with the staff. I want to end up the surgery as fast as possible. I take the manual wrench, I try to force the implant insertion, and I break my connection. I have 1 error and 2 different consequences. So why the pilots do errors, but in the same time have almost no complication? It's because during the last 40 years or 30 years, the pilot community has worked a lot on the detection of the menace, the different threats during the different procedures. The checklist is probably the most efficient way to avoid that an errors become a complications. But you can see on this